took it for the first time just to see what would happen.
All it took was one time for me to be addicted.
And at the end of that time, I was taking about 500 milligrams of opiate narcotics.
Looking back, there was nothing about my day that was safe.
I worked impaired every day for over a year and a half.
It's amazing to me that I was not caught.
At that moment, I had basically just given up all hope, and I just thought that I would overdose and somebody would find me or I would die.
Healthcare workers addicted to prescription drugs. It's an issue impacting more than 100,000 doctors, nurses, and other medical professionals each and every year across the country.
I spent 9 months active in my disease, and nobody suspected anything.
ANITA BERTRAND is part of that statistic. As a nurse anesthesiologist in Houston, ANITA had no history of drug use before she got hooked on pain medication following an abdominal surgery.
People's lives were in my hands. I put this person to sleep. They're asleep and having surgery. And I'm thinking about, when can I get some more narcotic?
Before she knew it, ANITA had resorted to drug diversion, the official term for stealing drugs. It got so bad, ANITA even put an intravenous port into her ankle to inject drugs more efficiently.
Addiction to opiate narcotics really sucked the life out of me in every aspect of my life. In the morning when I got out of bed, I felt like an 80-year-old man. I was in my early and mid-30s, and literally it hurt every step that I took.
Stephen LOYD turned to prescription painkillers to deal with stress during his residency. By the time he was practicing internal medicine, he was gobbling up to 100 pain pills a day, Percocet, Vicodin, whatever he could get his hands on.
The risks that I took every day were scary for me even to think about today, because it was with my patients. In a lot of ways it doesn't even seem real, but it was. And it was only because of the real competency of the folks that I worked with that something bad didn't happen.
Not everyone is so lucky. Laura LOLLINI went into a Denver hospital for a routine kidney stone surgery, but within weeks, she started developing strange symptoms.
Really fatigued, very tired, definitely some nausea, and I just thought maybe I was working too hard.
A series of blood tests and scans led to a scary diagnosis.
As he was telling me protocol and what I should do, I read the words hepatitis, and my heart sunk.
But the worst news was yet to come. News broke that a surgical tech that was part of the team that operated on Lauren was caught diverting drugs.
So basically, she was taking syringes that were full of fentanyl, a painkiller. She was injecting herself. She had hepatitis C, and then refilling them with saline and putting them back on surgical trays. So not only, did I not have the pain medication that I needed, I also had hepatitis C.
USA Today reviewed thousands of government records and found that effective safeguards to detect and prevent drug use are rarely employed in healthcare facilities. In fact, no state has universal drug testing requirements. And if offenders are caught, disciplinary action is rare. Often, staffers are simply turned loose to find new jobs without treatment or supervision. The University of Tennessee Medical Center decided to tackle drug diversion and placed Kimberly New in charge of controlled substance surveillance.
So we initially identified more than one healthcare provider per month that was diverting within the facility.
New says it's a practice that happens much more often than people realize.
Any healthcare facility that handles controlled substances will have diversion going on.
New says drug diversion is both an addiction treatment issue and a law enforcement issue. She says it places patients in danger and is a felony in every state. But at the same time, those drug-addicted healthcare providers need access to rehabilitation so they can return to safe practice.
A couple of things that I think are very important include reporting standards that require institutions to report drug diversion to regulatory authorities and law enforcement. In addition, having some type of immunity provisions for healthcare facilities so that they can openly give references relating to drug diversion issues and other patient safety events.
can be good and bad.
Stephen Lloyd and ANITA Bertrand have successfully completed treatment for their drug addictions. They're now counseling and educating other healthcare providers about the enormous dangers of drug diversion. Stephen hopes his efforts will help prevent others from falling into the same traps.
My life has only gotten better, both professionally and personally. And I want people to see that and maybe start to erase some of this stigma and start to give folks opportunities to come out of hiding and get into treatment and get better themselves.